Our laws, as it pertains to substances, are draconian and bizarre. The psychopaths start this way. He was an alcoholic because of social media and pornography, PTSD, love addiction, fentanyl and heroin. Ridiculous. I'm a doctor, for Christ's sake. Where the hell do you think I learned that? I'm just saying, you go to treatment before you kill people. I am a clinician. I observe things about these chemicals. Let's just deal with what's real. We used to get these calls on Loveline all the time. Educate adolescents and to prevent and to treat. If you have trouble you can't stop and you want help stop it, I can help. I got a lot to say. I got a lot more to say.
Susan. Hey, everybody. Welcome. And we are also live on Clubhouse. We're going to be taking calls. Ask me anything there. To be a part of the stream here, you just raise your hand and I will call you up to the podium. Appreciate you guys being here. I'm also watching you guys on the Restream chat. So
can you explain what Clubhouse is in case somebody wants to join?
I don't know. How can you get people to join, Susan?
They have to go send me their phone number to contact@drdrew.com.
Okay. Contact.dr.com, and then they can refer you for a sign up.
Yeah, but give me your cell phone number and I'll send it over to Joe and he'll give you an invite.
Joe has the invites. Okay, fantastic.
I have some too, but he likes giving his up first.
So we sort of have limited numbers of invites, but we like to sort of hand them out to people as people become interested in Clubhouse. And Clubhouse is just a place, it's an audio platform where you can take calls, listen to conversation, that sort of thing.
For phone calls.
And yeah, very excellent, high quality sort of sound. And we will be taking calls from Clubhouse today. And a reminder to those of you who are on Clubhouse who raise your hand to come up to the podium. You'll be streaming on YouTube, Facebook, Twitch, and what are they about? Twitter.
Facebook,
Twitch,
Twitter.
Yep.
Twitter.
All those things. Interesting. Now, Susan, earlier today you were sending me something from Dr. Peter McCullough. I wasn't quite sure what that was all about.
Oh, he was a great guest.
Yes, he was an interesting
yesterday, if
guest.
anybody missed it, he has my cell phone number and he texted me this morning. He said that it's very risky for you to have a vaccine after you've had COVID-19 and you should look out for psychiatric issues and take a baby aspirin every day.
Well,
I want you to talk to him though, because
that's good and bad
a
advice.
Personal thing for you.
Yeah, that's good and bad advice. So the baby aspirin today, I actively avoided. If you remember, Dr. Monica Gandhi said, whatever you do, don't take your aspirin because of the consumptive coagulopathy, which I stopped the aspirin for a while and I've restarted again. So that's already in place. And the psychiatric stuff, I told you I've been having some of those things.
Yeah, so he said that he sees a lot of patients who have sort of a weird long hauler syndrome type thing or psychiatric problems anyways, I told him to talk to you because it just scares the shit out of me and I really don't want to know.
I don't think I would worry too much about it.
No, but I honestly think that he is a good resource because he's on the front lines,
Yes, and he's a well-qualified academic. He's been in the field for a long time. The fact that people like him are being silenced is really what outrages me. I mean, you can disagree with him all you want and you can fight, he's willing to engage, no problem. But the fact that we have these highly, highly trained with decades of clinical experience clinicians who are being not just ignored, but actively, censorship is not a strong enough word. And they're actively trying to destroy these guys that are just trying to render an opinion.
Good medical advice. He also told me to tell Jordan not to get the vaccine because he had COVID. And I said, well, what about after? He goes, he should never need one.
That's probably true. That's not necessarily true. It's probably true. And I wouldn't, and again, there's a lot of panic porn. Once again, the press cannot. It's like it's addicted to trying to panic the American population. To be fair,
I'm not panicked. I don't think he needs one either. He had COVID.
Hang on. You're not listening to me.
I don't want him.
You're not listening to me. You're not listening to me. To be fair, we were just in Western Europe where the panic porn is not quite as bad, but at least the governments are engaged in the panic porn as much as the press is here. But here, the press seems absolutely addicted to the panic porn. And wherever you turn right now, all you hear is stories about the Delta virus. In fact, I was watching the BBC 2 days ago, and some alleged infectious disease doctor got up and just rang the panic alarm about the Delta virus, which doesn't look bad. Maybe I'm wrong, but it looks as though it is certainly more contagious. And the way coronaviruses typically evolve in the face of evolutionary stressors like vaccines is they become more contagious and less virulent. So it's easier to get them, but they cause less serious illness. And that's certainly what we're seeing here. Let's see.
I don't think it's a one size fits all. I think that everybody needs to go to your doctor and ask if you're a candidate, if you're too young, if you're, you have too many pre-existing conditions, and if the vaccine is good for you. So it's not like a one size fits all,
Yeah.
And he's worried about you because of, you really probably shouldn't have had it. You did have a reaction to it. Thank God
Yeah.
it was not fatal, or hopefully it didn't do anything else to your brain. But, I can't tell you. You seem fine to me.
Yeah. I think whatever I have is from COVID, not from the vaccine.
But you learned Greek. I mean, you were speaking the Greek language for 2 weeks very well.
Yeah, that
so
was
it's
weird.
not like your brain.
No.
dead.
Cognitively, I'm fine, but I've been a little irritable, I'd say, but that's all right. Did somebody
that's just 'cause you live with me.
commandeer Casey Gates's Twitch account? There's something very strange going on there. So, Tom Cigar, maybe you can take a look at that and see what's going on there. And let's see. I'm sorry. I'm just looking at the restream before we go out to the Clubhouse folks. In any event, Andras Kazvili is saying that the Delta is already gone, that they're worried now about the Lambda. But I got to tell you, I'm a little worried about Lambda. I'm not worried about Delta. I'm worried about Lambda if the Peruvian data proves to be correct. We're seeing more contagiousness than Delta, meaning it will kind of move in here for sure.
Oh, Drew, you're in private on Clubhouse.
What does that mean?
That's what Joe said. You're on private. You need to unprivate yourself.
How do you
How many
do
people
that?
are on there?
50 or so, something like that. How do we?
Let me see. Our producer Joe Giannotti. No one can enter because it's in private.
There's all kinds of people in here.
Okay.
And hands are up and everything.
Joe's had a rough day.
Joe's having some trouble with it. Let me get some.
Did you?
Yeah, there are plenty of people in there right now.
Oh, thanks, Caleb.
So anyway, to Lambda, if the Peruvian data proved to be even reflective of reality, it has a 10% mortality rate overall and a higher infectivity. That's concerning. Now, we don't know, A, if that data is accurate, and B, is it only old people in that 10%, sort of profile? We don't know. But it's something to keep an eye on. That's all I'm saying. All right, let me bring up some folks from the Clubhouse, see what their questions might be, and we'll just kind of go from there. Eve, go ahead.
Hey, Dr. Drew.
Hey there.
Happy to see you here. We had a run-in many, many years ago. I had a studio downtown on 7th and Santa Fe. The mom was from La Poubelle. She's owned La Poubelles on Franklin.
Oh, yeah, I remember it well.
And her son, Gerald, was a drug addict. And I threw something for him at my studio.
I remember that vividly.
Yes.
I remember it. And that was first, well, Gerald really struggled. B, that was a great event back when the sort of arts district in Los Angeles was just getting going.
It was just getting going.
Yeah.
I was down there in the beginning trying to help all that happen. And you came down and lend a hand with Gerald, which I really wanted to thank you for even attempting to do such a thing. I took some extremes in how I did things, and I was just hoping to be a part of this in any way. Once I really know what you're on about, I just wanted to show up.
Great. Well, I appreciate it. We're just sort of chatting. Any questions people have, it's just a chance to kind of chat it up.
Okay, wonderful. I want to ask us first a little question that might be strange, but because it's pertaining to drugs and Native Americans, things like ayahuasca, things like peyote, things that people are kind of taking now, saying they're having, the nice cosmic trip, which we did all this stuff a long time ago. That's why I was doing this with Gerald. I can't even remember the year. It was such a
it was like 20 years ago almost.
Yeah, my daughter was 4. She's 20 now.
So 16 years ago.
Paloma. Mm-hmm. So that was a long time. So I've been experiencing, the new, the young, the what's happening, because I tend to be in that world, because I'm a painter and I always have a studio, which I'm searching for right now after making it through the pandemic. But I was curious about what advice might be given to them from a sort of medicine point of view. The Native Americans had a point. I'm wondering how it looks for everyday people today.
I'm not sure I get put that in the form of a question. I'll make sure I really understand your question.
Here's a question.
Yeah.
Can it be looked at as a medicine?
Yeah.
How do you-
Hallucinogenics you're talking about.
Yes.
Yeah. Okay. So
Those particular type, for instance.
yeah. Okay.
That's kind of become popular now.
Yeah. Okay.
Ayahuasca is popular now. People
Yes.
think, you know, things
All right.
like that.
Anthony, I'm going to put you back in the audience and sort of talk about this for a minute. So in broad strokes, we're talking about hallucinogenics and their therapeutic properties. Of course, I think most people are aware that the Multidisciplinary Society for the Advancement of Psychedelic Studies, MAPS, I think is their acronym, MAPS. I've interviewed their founder. He just published some data on the use of MDMA in PTSD setting for trauma therapy. But I interviewed him at length, and he's very clear that these are therapeutic medications, but have lots of potential risks associated with them and should only be used, from his perspective, in the context of a therapeutic setting where people really know how to use these things and people who have failed other interventions that are less risky, so-called. Now, the hallucinogenics are in multiple different categories, right? You're talking about the ayahuasca and ibogaine, which has been around for a long time. People have been using it for a long time for the treatment of addiction. Again, treatment of addiction. And when people go down to other countries, and again, what they're calling ibogaine and ayahuasca, it's different things. And it's hard to sort of standardize what it is people are getting exposed to, but I generally see people have three different experiences and about into 30% categories. 30% saying it's the worst experience they ever had, 30% saying it was a nothing, and 30% saying it was profound. So 60% of people have a bad or neutral experience, and that's a pretty bad track record for a so-called therapeutic medication, particularly when it comes to psychotropic medicines. Generally, when people... I've been very, very concerned about hallucinogenics because I've seen brain damage from them, primarily the psychedelics like LSD. I've never seen brain damage from mushrooms, so mushrooms are a hot area of research right now. I do believe they will have therapeutic value. They clearly have therapeutic value in end-of-life anxiety, end-of-life dread. So when people have a terminal prognosis and they're approaching death and they're overwhelmed by anxiety or dread, the hallucinogens, both the LSD and the mushrooms, have been shown to be very beneficial in reducing that dread. May also cause brain damage, but there's no concern about that because that person's going to die in a very short order. So the brain damage is not a concern. For somebody who has a long life ahead of them, it's a very serious concern. I've seen mood disturbances, memory problems, learning problems, personality changes, and some of them have been permanent. So that's been concerning to me. In terms of using ibogaine or I dropped the name of the other one. This is since COVID, I have a little bit of more word finding problem than usual. Help me, Susan. What were we just talking about? Anyway,
I wasn't listening.
Thank you. In any event, these plant-based hallucinogenics, they have been used. People swear that they're effective. In my experience, I've seen lots of people go use these, particularly if you're opiate addiction. Now, again, opiate addiction is a life-threatening, dangerous problem. I think people finally understand that now. And I've seen typically people stop using the opiates for about 6 months, typically, and then go back. I've only seen one, maybe two, for sure one case where that didn't happen. Mind you, that's out of hundreds. So I'm not thoroughly sold on this. Now, that one case, by the way, I don't think was an addict per se. I interviewed him a little bit, and he seemed to have been more of a drug dependent, non-addicted. That's sort of a separate category of opiate use that we never used to see, that we now see lots of because, I mean, Gerald, the guy you'd mentioned from La Poubelle, that guy was a full classic, full-on drug opiate addict. But because of the overprescribing of opiates by physicians, we now have people that look like opiate addicts that really are just strung out on them and will stop using them when we get them off. So it's a really kind of an interesting thing. So bottom line is much more research is needed. And I'm super clear that when it comes to addiction, none of the effects are due to some magical insight. All of it is due to altering brain function. So it's not as though that some cool insight is at hand. George Clark, I wonder if you agree with me on this or have you seen something different? Let's get George up here. George. Oh, I got to try it again. Hold on. Getting weird glitches in Clubhouse these days. George, you see stuff like that?
Opioid.
Uh-oh, your connection is really bad.
Sorry, I'm on a bus. Can you hear me?
Yeah, I hear you bad.
So, give me a summary of what am I seeing, like on the streets of New York, stuff like that?
No. Have you seen people use hallucinogenic therapies for addiction to any benefit? I was saying I rarely see it have a sustained effect.
I've never seen it, and well, I can't say I've never seen it, but even if I did, I'm not in a position to really know, or understand the science behind it.
Okay.
But what I have seen, the opioid problem in New York City is, it's been worse over the pandemic for sure. There was a tent city outside my house.
Yeah.
Up until a few weeks ago. But someone I work with in my job was classic, hurt his back in the 90s, went in, got opioids, got strung out on them, kicked them, then switched to alcohol, and then eventually kicked that.
Yeah.
So that I've seen.
That's a very common thing. Well, not very common. It's a typical thing. People think if they stop the drug that they have as their problem, they're magically going to be okay. But inevitably, something else will pick up because it's a biological disorder of the sort of what I call the do it again part of the brain, and it's a resetting of what that part of the brain needs you to do in order to be consistent with survival. Even though that part of the brain doesn't really think, it's a part of the brain that will fight as though it were a life-threatening importance to get you to do this behavior again that activates the biology of the shell of the nucleus accumbens, essentially. How are you? Doing okay otherwise?
Yeah, it's disgustingly hot up here.
In New York City?
Yeah, it's 91 with feels like 100% humidity. So it's
great.
Cool.
Well, the city's coming back to life, isn't it?
It is, but the crime is still an issue.
All right, I know. I moved you to the audience because my producer is telling me the sound is not worthy, so I apologize for that. Let me.
We love you, George.
Yeah, George, thank you. I'm going back up to Aisa. I think is what I'm. Aisa, am I getting that name right? Aisa, did I get that correct?
Yeah.
Hey there.
It is correct.
How are you?
Good.
Questions?
Yeah. I have two questions. One is pertaining to me personally, and the other one is very general. The first one that is pertaining to me is that I think there are two kinds of people who have schizophrenia. The ones who have schizophrenia that they don't know themselves that they are having schizophrenia, but it's no. And I think there is another phenomenon of having schizophrenia. That's the one who is having this kind of phenomenon. Knows that he is having it, but others cannot notice it. I call this one is the schizophrenic self, is a kind of having two identities or two minds within the same body. I want just to know if it is scientifically proven that schizophrenia is of two distinct phenomena, the one that can be known and seen by others and not known for
there are.
the person himself.
I've never seen anybody break it down that way. Most people with serious mental illness of all types, including schizophrenia, have a form frost of something called anosognosia, which is a block in the ability to have insight into both the symptomatologies and the impact the symptomatologies are having on your life. If you have a delusion, you simply think those delusions are true. You don't think, hey, I'm having a delusion. Isn't that bizarre? Now, people with certain kinds of schizophrenia, again, there's many different subtypes of schizophrenia, some more mild, some more severe, but many of different subtypes can be treated with cognitive behavioral therapies where they can learn to identify their delusions. So even though they believe them to be true, somebody can teach them when those thoughts come up. Remember, schizophrenia is a thought disorder. It's a disorder of thinking. And as such, when you have a disordered thinking, you can't think your way into insight. You can't think your way out of it. It's a biological event that you were just in. And so the anosognosia. Now, in terms of, being of two minds and all this stuff, I don't know quite what you're talking about. That's more dissociative disorders, people that dissociate and have certain personality styles or certain ways of relating in certain environments and have certain experiences. Again, usually around the phenomenon of dissociation, that's where you typically see those things that I think you're talking about.
Experience that I've been under, and you can diagnose my
Sure. Sure.
yeah,
We can talk about
sometimes
cases like you. We can't diagnose you.
yeah
We can talk about cases like you. Okay.
yeah sometimes I'm extremely sociable,
Mhm.
socializing with others with no problem,
Mhm.
and other times I am extremely introverted,
Mhm.
having myself into my own bubble, my comfort zone.
Mhm. Me too. That's your personality functioning. I
Is
don't
it
know if you
normal,
have,
Pip?
maybe you have a social anxiety disorder overlying it or something that motivates you to stay isolated, but none of that sounds unusual.
Yeah. Is it prior symptoms to something pertaining to psychopathic or sociopathic personalities,
No,
or
no,
is it
no, no, no. The fact that
normal?
you're like we always say, people that have serious mental illness don't think they have serious mental illness. They don't worry about themselves and don't sit there anxiously diagnosing themselves. Those are people with personality issues, mood disturbances, anxiety disorders, but not people with serious mental illness. And in terms of psychopathy and sociopathy, the telltale sign for psychopathy is you are gratified by torturing animals in childhood, gratified by taking advantage of other people, not having any understanding of emotions at all, but sort of learning how to adapt and behave as though you had emotions, like learning what emotions are from other people, but not really having them yourself. Sociopaths, and again, this is my way of categorizing these. There's some debate about how to do so. Sociopaths are people that take advantage of other people. They know well what emotions are, but they take advantage of other people and will exploit and use them without caring about them to get their own needs met. It's like a severe narcissism. And these are, and it's the thinking is that psychopathy is a biological disorder. I refer you to Dr. James Fallon, Fallon. We did an interview with him here, didn't we, Susan? Dr. Fallon?
Weekly Infusion.
Oh, it was on Weekly Infusion. So
I think maybe we had him on Ask too. We
he's
should get him back.
a psychologist who was studying psychopathy and discovered, lo and behold, he was a psychopath.
Mhm.
And he has a TED Talk series out there and a bunch of YouTubes and things, so you can learn more about psychopathy from him. But it sounds like more than anything, you have an anxiety disorder for sure. And I don't know that you do, but it sounds like you might be someone with anxiety disorder and difficulty finding your way. People have to form a cohesive identity before they stop thinking this way, worrying about, what's wrong with them. Okay, Tom Segura. That's rage, huh? Okay, let me get another call up here. Tom Segura.
What is Tom doing? How was the storm?
Oh yeah, Tom's. How was the storm out there? Has it hit yet? Even did it even go through Florida? I mean,
I don't think it was a big one.
I mean, all you could hear is it's now a hurricane, and then all of a sudden it's like, yep, nothing. So again, the press is disgusting. I don't know if anybody else is as disgusted with them as I am. If you are in the audience, you can just raise your hand, and I'll bring you up to the podium. And again, you'll be streaming on YouTube, Twitch, Twitter, and Facebook. And this is Charles. What's going on, Charles? Things seem to have frozen a little bit.
There's always a little lag before they get on.
Charles, your mic is muted. There you are. What's going on?
Yeah. I was in the storm.
How was it?
It basically sideswiped most of Florida. So it was just a storm. It was not a hurricane here. It was a lot of thunder, lightning, rain.
Cool.
It was not too bad. Is psilocybin the other medicine that you were thinking of?
No, it was ibogaine and ayahuasca. It was ayahuasca was the other one I was thinking of.
Oh, okay. I just wanted to mention, I was watching Steve Kirsch the other day talk to Dr. Bean, and you were mentioning, what happened to our profession. And Steve mentioned the word regulatory capture.
Mm-hmm.
And I think when they look back on this, that's going to be a big part of the basis of this whole problem.
And what was you referring to? What does that mean? Regulatory capture?
Well, the pharmaceutical companies basically bought and sold Tedros, the people at the CDC, Chris Whitty, and these others. And
But Charles,
the
my
media
thing
went.
is, how did those people get to take away the volitional and sacred obligation of every physician in this country to make decisions on behalf of each individual patient they're caring for? We relinquished
didn't.
all
They
of that
didn't.
to the
They
bureaucrats.
didn't.
We just
They
relinquished it.
well, not the renegades. They
A few
didn't. They
did not.
didn't.
A few did not.
They
But
didn't capture Didier Raoul. They didn't capture um, uh, these doctors in Broward County and various others. But the vast majority of people, at the Mayo Clinic, at Mass General, that you would expect to have come up with some protocol, basically were bought and sold.
I think here, I think it's you're thinking about it a little bit different. I don't disagree with your basic sort of conclusion, but I think it's a little subtler than that, because how did a pharmaceutical company have anything to do with everybody practicing medicine here in Pasadena? Nothing, zero, nothing, nowhere. Okay. However,
Well, it became communized.
right, because
In other words,
everybody immediately froze in place and looked to the bureaucrats, which is nothing we've ever done before.
They don't do that with urinary tract infections.
Right. We've never done it with anything. We've never
gastritis.
done it, period. We didn't do it with H1N1. We didn't do it with MERS. We didn't with SARS. We looked to them for a little background guidance as we worked our way through treating patients with these pandemic illnesses. When I had H1N1, it wasn't like the infectious disease doctor I was working with was guided by the policies of Anthony Fauci or the U.S. government. They had nothing to do with my treatment for the pandemic at the time. All of a sudden, we just let go of everything we do.
Regulatory capture.
Well, then it was primed for that.
I would say it was even larger than just regulatory capture. It was also media capture.
Oh my God, yes. Well,
a group of pharmaceutical companies basically somehow took over the regulatory groups, which is fairly easy to understand. But then they went one step even further, and they somehow took over the media.
Yeah. Well, here's how my perspective. Because do you think that until this pandemic, the FDA, the NIH, the CDC ever had anything to do with my practice of medicine or anyone in my community's practice of medicine? Nothing. Nothing.
No, but the media made people think that they do.
Correct. And the FDA would give guidelines to the drug companies in terms of what they could give me access to, but I could do whatever I wanted with those drugs.
Right. They didn't extend this into how often you should get a mammogram.
I even saw people talking about
I
even saw people talking about the AMA, which has nothing to do with anybody's practice. Nothing. So these organizations have nothing to do with the practice of medicine ordinarily. And when they are functioning, I'm not surprised. I would be surprised to see that they have are influenced by their financial resources and where they get their sort of funding for things. That makes sense to me. But we had no business ceding our responsibility to these people. We've never done it in the history of medicine. And then these state and local healthcare officials took control, many of them not even doctors. And here in LA County, we had a sociologist. I mean, this was breathtakingly irresponsible, and the level of incompetence that was on display was phenomenal.
They did this only in the background of the support of the regulators.
Yeah. And think about it this way.
And the support of the media.
And think about and if you go back, look at what the media did. Media grabbed onto what the Chinese Communist Party did in China, in Wuhan, and said, we must do that. And that was not a medical intervention. That was some sort of political intervention to save face. I don't know what it was. I don't know if it was rehearsed. I don't know if they had that ready at hand to do those sorts of things because they had a dangerous laboratory there. I don't know. But that was not a medically directed intervention. That was a political maneuver. And we had the press in this country from day one demanding that we do the same thing that the CCP did. Go back and look at it. You'll see. I lived through it in a vivid way.
You've done a good job.
It was tough. I was wrong about a lot of stuff too. Listen, I was wrong about a lot of stuff as well.
No. when they look back on this, you and Dr. Bean and a few others are going to come out looking really, really good.
Well, we'll see. We'll see. That's not my goal. My goal is for us all to get through this and get back to our lives.
That's why you're going to come out looking good.
All right, my friend. Thank you, Charles. I appreciate
Take care,
it. Okay, man. I am being
that was nice.
It's very nice. I'm being prompted to mention that, and Caleb, you're gonna have to jump in here. We have a new channel on Rumble, rumble.com/Dr. Drew. Is Rumble available right now to our streamers? Is that the deal? Caleb,
yes, actually. It's live right now.
How do they find it?
Watch us on
Just go to rumble.com/Dr. Drew and boom, we go.
That's
and will that show up? Is there a
Dr.
chat
Drew.
that will show up? And is there a chat that will show up on my stream here?
Yep, it'll pop up. It won't pop up in the restream chat that's over on the side of the channel, but it's another channel that people can watch us on.
So I won't see any chat come out of there on my restream.
Not yet.
Accurate?
They don't have it built in yet.
Okay. All right, good. All right, so rumble.com/Dr. Drew, and give us 2 seconds on what Rumble is. I don't know. I'm not familiar with that platform.
Rumble is kind of a newer platform that stands for anti-censorship stuff. We started there specifically because of the YouTube strikes that they kept throwing around. And now, you've always wanted to be on all platforms at the same time. So
Yeah. I would feel like we got to just push it out wherever we can, and that's the way to do things. So
Caleb, send me the login so I can look at it.
I'll send it.
Excellent.
So I can download it and see what's going on.
Why don't we go ahead and take a little break, Caleb? We'll take a little break here. We are, just a reminder, we are on Clubhouse. We are taking your questions there. You can raise your hand. I see several of you there.
You're gonna have to listen to our ads today too.
Yeah, with our hands up, Caleb has to play some ads here for this for the restream.
To pay the bills.
And Kristen, Sherwin, Liam, I see you guys there with your hands up. I will be with you just after we take this brief pause. I want to give a shout out to our good friends at Blue Mics. If you've heard my voice on this show any time over the past year, including right now, you've been listening to Blue microphones. And let me tell you, after more than 30 years in broadcasting, I don't think I have ever sounded better. But you don't need to be a pro or have a fancy studio to benefit from a quality mic. You may not realize it, but if you've been working from home or using Zoom to chat with friends, you probably spend a lot of time in front of a microphone. So why not sound your best? Whether you're doing video conferencing, podcasting, recording music, or hosting a talk show, Blue has you covered. From the USB series that plugs right into your computer to XLR professional mics like the Mouse or the Blueberry we use in the studio right now. Bottom line, there's a Blue microphone to fit your budget and need. I can't say enough about Blue mics, and once you try one, you will never go back. Trust me. To take your audio to the next level, go to drdrew.com/blue. That is drdrew.com/BLUE. Anyone who's watched me over the years knows that I'm obsessed with Hydrolyte. In my opinion, the best oral rehydration product on the market. I literally use it every day. My family uses it. When I had COVID, I'm telling you, Hydrolyte contributed to my recovery, kept me hydrated. Now, with things finally reopening back around the country, the potential exposure to the common cold is always around. And like always, Hydrolyte has got your back. Hydrolyte Plus Immunity, my new favorite, starts with their fast-absorbing electrolytes and adds a host of great ingredients. Plus, each single serving easy pour drink mix contains 1,000 milligrams of vitamin C, 300 milligrams of elderberry extract. Hydrolyte Plus Immunity comes in convenient, easy to pour sticks that rapidly dissolve in water, make a great tasting drink, has 75% less sugar than your typical sports drink. Uses all natural flavors, gluten-free, dairy-free, caffeine-free, non-GMO, and even vegan. Hydrolyte Plus Immunity is also now available in ready-to-drink bottles at the Walmart next to the pharmacy. Or as always, you can find it by visiting hydrolyte.com/Dr. Drew. Again, that is HYDRALYTE.com/DRDREW. Be sure to use the code Dr. Drew 25 for a special discount. Uh-oh.
There you go.
Here we are.
And we're back.
I don't see myself, though. I'm frozen up there under the Hydrolyte banner.
Oh, no.
Yes.
Ruh-roh.
Is that at your end, the problem?
Uh-oh.
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 Are we going to be able to get our cameras back? Technical difficulties.
Oh, no.
Hold on.
Is it that high-res video screwing it up?
I believe you guys, yes, they hear me. They just don't see anything. So that's good. So you hear us.
Good enough. It is a radio show today.
Yeah, well.
Hopefully.
Seems like it's something you should be able to.
Is there something I can do, Caleb?
No, it just
He's busy trying to fix things.
I'm fixing it.
It'll fix it.
Okay.
May I go to some calls
Shit happens.
while we're doing
You
it?
can still talk.
Yeah, so let's do it.
Oh yeah,
Good
we can still
catch.
hear you.
Kristen, what's going on? Okay, good. Let's keep going. Kristen, what's going on?
Hi, Dr. Drew.
Hi, Kristen.
I am calling. I'm a nurse in Southern California, specifically your community, San Gabriel Valley.
Great.
So I was vaccinated back in December 24th specifically, and I have been suffering for 6 months with a laundry list of neuro and vascular side effects from that vaccine. I would say about January, February, I was following your COVID journey, and I hooked up with the Incel DX team.
Good. Which is Dr. Yo and Dr. Patterson.
Yes.
Excellent.
Yes. So after a while, they were open to, they've started looking at more of the vaccine related injuries in addition to the COVID long haulers.
Correct.
And I had my blood work done with them, the cytokine panel.
Right.
And yes, indeed, I had a long haulers index, however, tested negative multiple times.
For
COVID.
Okay, got it. So it's vaccine related, yes.
It was vaccine related.
Yeah.
I know in my heart of hearts.
He has a whole cohort now of people like you. This is not, this is a thing.
Yeah, but the minute I got the vaccine, I had like a flesh tingling sensation through my body.
It's funny. I do. Which vaccine did you have?
Pfizer.
I had Johnson & Johnson. I immediately had a body-wide chill. It was very strange.
Yes, yes.
Yeah.
And then it's like everything just slowly started adding on. So I'm so grateful to you because I found this team of wonderful, supportive doctors, and my internist has been extremely supportive.
Good.
But my question to you is, and I know like just in our community, you have a lot of respect, a lot of credibility. How do we, because I'm not the only one, and I know people, just among my friend group who've had reactions, they're going to the hospitals, they're getting turned away with anxiety diagnosis.
Oh boy.
I had horrible POTS-like symptoms, high tachycardia. And that's kind of what everyone says is, well, it's probably just stress, it's anxiety.
No. It's clearly not. Listen, plus you have an objective, objective evidence of active inflammatory disease. So let's not waste time talking about anxiety.
Exactly. How do we raise awareness with the healthcare community? Because it is like there are some wonderful doctors in our backyard who I have lost so much respect for.
I'm sorry to hear that.
They just won't connect the vaccine with these reactions.
Well, let's first just think about you being vaccinated. What kind of nursing do you do?
Well, now I'm not at the bedside.
And because that is happening, now we have to be on the lookout for, well, could we be seeing vasculopathies or organ damage from the vasculopathy? Probably, right? Probably that's a big part of this. Plus, there are other cytokine-induced, monocyte-induced sorts of inflammatory processes that we don't fully understand yet, but that are also part of why our brains aren't happy, right? Make us feel bad and to give us organ issues, organ performance issues, and also brain-related symptomatology. Now, what have you been treated with?
I am going on 6 weeks of ivermectin and low-dose steroid, and I'm going to start a statin.
And it's funny that the statins are. I just learned that the statins are showing some good effect. That was mind blowing to me. And have you had anything else before this?
Health-wise?
No. Have you been treated with anything else prior to this?
No.
Okay. And do you know? Did you have any abnormalities in the VEGF factor? The VEGF.
Yes, my VEGF was elevated. So was my RANTs.
Yeah.
They told me I had a long hauler index.
Yeah.
I was on that, definitely.
And is there a reason they didn't use fluvoxamine for you?
I did that for 15 days.
Okay. Didn't work.
I didn't notice any changes with it.
Okay, because that seems like where they probably would have started. Did you do that on your own, or did these guys recommend that?
No, no. They collaborate. You know, my doctor got on board with us, and so I did the 15-day.
I lost Kristen.
You know, the ivermectin and the low-dose steroids.
Okay, so and is Dr. Yo working with you personally, or some other doctor?
Yes, Dr. Yoan Patterson.
Okay. Hey, Dr. Yo is pretty optimistic about this particular protocol he's using. Last time I talked to him, he was very excited about it. So he would expect you to have some improvement. Has Moraviran?
Oh, I have.
Okay, good. You're on it now.
I've had significant improvement.
Oh,
I
good.
had numbness and tingling. I've had my hot symptoms have decreased.
Okay,
my
great.
Fatigue is improved. I do relapse I have a half a glass of wine, and it sets me back to January.
Gosh, I had a weird thing when I had
ringing in his ears when he drinks.
Yeah, I still have that. But I had a very weird thing, which a glass of wine, when I was with the long hauler fatigue, a glass of wine would relieve the fatigue. 2 glasses of wine would destroy me. It was very weird. It was very weird. I've had many, many weird and uncanny symptomatologies with this thing. It's been very strange.
Yes.
But fluvoxamine,
too. I cannot exercise.
No, there's no way I could have. But fluvoxamine pulled me out of that part.
How many weeks ago did she have COVID?
She had the vaccine in December.
Oh, it's from the vaccine.
Yeah, it's from the vaccine.
Yeah.
I
kind of just stuck it out and waited to get my blood work done back in March, and then we finally got the treatment going. So here I am. Probably in total, if we count the fluvoxamine, 8 weeks.
Can you write a little article for like a nursing journal or something, a little editorial, or a sort of personal story? There's always, journals do accept those kinds of things, right?
Yeah.
Because we gotta.
It just seems like a lot of doors close when you bring up the vaccine.
Well, I suppose you're right. I mean, because there's this huge fear that we're going to somehow increase vaccine hesitancy.
Exactly.
And I don't think, now maybe I don't want to speak on your behalf.
Go on Rumble.
But
well, she
but I don't
came
think,
on your show, Drew.
But I don't think either of us would want to increase vaccine hesitancy. Is that accurate?
Yeah, no, I'm definitely pro-vaccine. I've got 3 kids. They've all been vaccinated their entire lives. I mean, this isn't an anti-vax issue for me, but for me, it's more about educating our healthcare, our ERs, our urgent cares.
Right. So it should be. This is about preparing the medical system to help people that have an adverse reaction to the vaccine. That's all. Yes. It's not about not taking the vaccine. I mean, if anything, that should reduce hesitancy, because we could say, hey, if you have a reaction, you've heard about some long hauler stuff in the press or whatever, or you heard it on sort of scuttlebutt online, we have treatments for that. We can make you better. So relax, take the vaccine. You know what I mean?
Exactly.
That's how we should be approaching this. But of course, in this world of no communication, it's just.
It's just so frustrating, because I've worked at my employment place since I was a new grad nurse, back in the 90s. And it's shocking to me.
Isn't it weird?
We
What,
just
what,
won't talk about the elephant in the room.
what do you have any specific thoughts about how we got here? I'm wondering from your perspective if you have any insight. I'm trying to figure it out because it was truly uncanny. This whole thing was nothing I've ever seen.
I personally, I just feel, unfortunately, this issue has been politicized so much, and I don't understand how healthcare and politics became so intermeshed.
Right.
But I think that's our big problem.
Yes, I would agree with you. Well, Kristen, Kirsten, right? Kirsten, am I getting that right?
Kirsten.
I
Yes.
really appreciate you coming in and talking about this, and keep talking about it so people can, if they hear similar symptomatology themselves, that they know that they can go to covidlonghaulers.com and sort of sign in there, figure things out. And if any of you are physicians or healthcare providers, listen carefully to what Kirsten is telling you. These are not anxiety disorders. And by the way, even though you had prominent POTS, a lot of the patients I saw early on in this thing, both from the POTS from COVID and the POTS from the vaccine, were given breathing exercises that did nothing. They did nothing except frustrate the patients. So it's not something easy to manage.
Exactly. Yeah. I mean, even just people will respond back and say, hey, my doctor put me on a Medril dose pack, or it's like, well, okay, but that's really not,
too sloppy.
I don't know.
Too sloppy.
Yeah.
There's a more systematic way to do this. And by the way, you don't need that much steroid. A dose pack is too much. And this, my prediction is over the next 3 months, maybe 6, hopefully 3, we'll see a lot of refinement because Yo and Patterson will publish what they're seeing. And we see a lot of refinement in the approach to this stuff. And be very interesting to see how it plays out. But Kristen, thank you so much for speaking up and talking about this and stepping in here. I'm going to bring other people up on the phone here. Let me just quickly, they've got a good lineup of people here really quickly. This is Bree. Bree, go on. Bree, go ahead.
Hi, Dr. Drew. So my name is Bree Andressen. I know Kirsten very well, and several other people that unfortunately have experienced the neurological reactions to the COVID vaccine. Mm-hmm. I was actually one of those that was in the clinical trials. Mm-hmm. And so I was one of the first to experience the neurological decline. Mm-hmm. So my question is, obviously Patterson's running his study. It's very compelling, also somewhat disturbing. And then we also have the NIH that's working on their study. Their information is also interesting. They're going the same route with long haulers and vaccine long haulers. And then there's also Mayo that's doing some studies as well.
Right.
But the problem is of course, because of the stigma, we're not allowed to talk about it. Mm-hmm. And so what's happened, and as you've seen as well, is that no one's able to get adequate medical care.
Right.
And so it's strange to be in this kind of alternate reality with everyone, right? That we're all moving in this, and we can't say anything.
Medicine is replete with patient populations that get stuck in these sort of neverlands. Fibromyalgia and chronic fatigue and all that stuff. It has neurasthenia. These have always been sort of patted on the back and sort of set on their way and not really carefully managed.
Yes, exactly. Mm-hmm. So it's been kind of strange to also be in this situation where if we just talked about this, right, mm-hmm. and just like you were saying with the informed consent, mm-hmm. I absolutely do not believe that if we provided informed consent to the American public, mm-hmm. that they would stop vaccinating.
Correct.
People are going to choose to be vaccinated, and they will be armed with the knowledge they need.
Well, also, and in fact, people tend to get more paranoid when they feel like things are obfuscated, like there's something they're not telling me. Then they freeze in place, right?
Absolutely. So now we're giving them fuel to the fire, right?
Yeah.
And so now we're in this movement where we're trying to be seen, we're trying to be heard. And now we have conspiracy theorists pounding down our doors, right? Just give us your ammo, please.
No.
And in the meantime, we are knocking on legitimate media, right? For months we've been doing this, and we haven't gotten it anywhere, unfortunately.
Well,
so,
And when you say legitimate media, have you tried maybe international press at all? Have you tried like the BBC?
Yes, we've contacted BBC. We've contacted, actually, we've reached out to Israeli press as well. They're working with one of our people. It was CNN CBS, all of them. So it's been pretty interesting because we haven't gotten any snags. We have a couple of freelance journalists that have been following us for a couple of months. We had a very prestigious editor at New York Times that was following us, and then she couldn't run it either. We even tried to pay for a PR company. We tried to pay them $1,000 to do a press release, and they couldn't, and they wouldn't. So unfortunately, even with the emerging case studies that actually corroborate our claims, show, causality, and we have 2 pages worth of documentation, scientific peer-reviewed journals for this.
Yeah. Has anybody stepped up with you, like Dr. Yo or Dr. Patterson, any of those guys that really know the landscape?
Yeah, so Dr. Yo, he actually, I'm sure you've seen his YouTube video where he came out. He's like, look, let's talk about the elephant in the room.
Yeah.
And we really appreciate that. And we're trying to get him hooked up with a major network right now.
Okay. All right.
But of course,
there's clearly, who knows if YouTube will give me a 3rd strike just for us having this conversation.
Well, we have Rumble now.
Yeah, they probably will.
Rumble, Facebook, we have Twitch, and we have Twitter.
So we understand
if we get cut off on YouTube, all you YouTube people need to stay on our Twitter and find out, because it could happen.
So we understand what you're up against. I do feel like things are loosening up a little bit. The ability to actually have this conversation on a large scale is clearly not going to happen in the short run, but it probably will happen soon. And I would just urge patience. I don't think anyone is going to get the vaccine that wouldn't have had they not heard your story. You know what I mean? And by the same token, I'm actually concerned there are people that are resisting taking the vaccine that would get it if they heard your story. You know what I mean? They would at least feel as though they're being given all the information and be less paranoid. So that bothers me, but I don't feel like it's going to be a major issue. And I would just you're on the side of a story that needs to be told and will get told eventually, and hang at it.
Hopefully, the whole reason we're doing this, I'm on the tail end of this thing.
Yeah.
I've been through the worst of it,
Sure. I'm glad you're better.
It's hard to, bring everybody along. There's like over 4,000 of us just in our group now, but it's just kind of sad that we know what we know. We know there are early intervention measures that can help. The NIH
if we hadn't been through just what we just went through, I wouldn't be I would be mortified by this. I'd be shocked and confused. But given what we've been through the last year, this makes perfect sense. The truth will prevail. And I would just urge you to be very, very cautious. Again, thank you, Bree. The website is COVID Long Haulers, covidlonghaulers.com. I'm glad she's better. I don't know if I'm going to pronounce your name correctly. Murja. She's not up there yet. Let me see if she enters the room. There you are. How can I help you? There you are.
Hi, Dr. Drew. Hi, everybody.
How are you?
I do have a question.
Yes, ma'am.
My question is, I know there are still a lot of people who are against taking the vaccine, and or some people feel like the whole COVID was like a hoax type of situation. And what do you have to say to that? Like, just because I think for me, I actually work in biotech, but I'm in a quality assurance role.
Yeah.
But I'm in cell and gene therapy. So my question to you is, why do you feel that people are not so in tune with taking the vaccine? And I think for me also, I think it's quite interesting that we've had so many outbreaks in the world or in the United States, but a vaccine was not the determining factor of keeping you safe. It seems like now with the COVID, it's almost like the vaccine is the determining factor of, should you wear a mask or should you not wear a mask?
Right.
This is Moja. I'm done speaking. I did take the vaccine, and I forgot the lady who spoke earlier. When she made the comment, she felt like the little tingle.
Yeah.
I felt that was my first dose, but I took Madonna. I felt that was my first dose as soon as they gave it to me, and I was fine with the first dose. But with the second dose, I definitely had the fever-like symptoms like 24 hours later.
Yeah.
But I was fine after that 24 hours.
So, well, good. And now protected, which is nice.
Yes.
Thank
you.
I've always felt that vaccine resistance was a byproduct of the terrible biological education we have done in this country. People do not understand biology and how biology works. They just are, I'm sorry, they have not even a beginning of a clue of biology. And you work in biotech, certainly you must see.
That would be me.
Well, you're actually better than most.
Well, I've been married to you for 30 years.
People believe, people believe
Is that your
these.
wife?
Yeah, that's my wife.
Yeah. Well, actually, we've almost been together for 40 years, but I was amedical when I came into this relationship.
Yeah. And people want to believe that biology functions like a narrative, that there's a subject and a predicate, and then you can conclude. And that is not, biology is more like a cloud. And it's a where the cloud is going and how it's forming is a giant probability notion. And that's biology. It's just a massive probabilistic soup. And, and it's extraordinarily complex, and the math is incredibly complicated. And I rarely come across someone who has even the most basic training in this area. You certainly must come across this as somebody who works in biotech, right?
So it's interesting you asked that question because my background actually stemmed from smallpox vaccine. I used to work for a company where we manufactured smallpox vaccine for the government. Then I moved into antibodies for like metastatic breast cancer, and now I'm in cell and gene therapy for HIV. And
Interesting.
My job recently started testing for COVID, and it was quite shocking to see how much samples we were still getting till today. And when it was implemented, the CEO did that to try to get us to feel safe in coming back into the office and knowing that we're going home safe to our families. Then it became an aspect of like a revenue for the company because it's still so busy. And, people are still catching COVID, even if the information is not put out there as much anymore. Yes.
Well, I don't have a good explanation. I'm not sure I quite got your question. What was the question exactly?
So my question is, we've had so many outbreaks in the world.
Yes.
In the world, we've had so many outbreaks. Yes. Of course, we have to take people have to get the flu vaccine and all that stuff. I'm saying that why is it now with the pandemic, people are still against getting vaccinated? And why is it also that the vaccine is now the determining factor of if she should wear a mask or do not wear a mask? For me, I'm still wearing a mask.
Okay. So I can't speak to the mask issue except that people are tired. And they want to know, I think, on some level, there's sort of a psychological phenomenon where people want to have some benefit to getting the vaccine. I'm taking that risk. I'm going to get the vaccine so I'm protected, my family's protected, and we do reduce the viral replication, so I help protect the world. But I want to be able to be freed up a little bit. And so there's mask fatigue. Now, the people are looking at the best studies show 15-20% efficacy of mask. It's not clear the masks are doing a lot, and so people are looking at that and thinking, it's probably not that necessary. If that Lambda thing takes off, we're going to see more masks, is my humble opinion. But in terms of the increase in vaccine hesitancy, I believe we have been through a huge delusional period. Like literally, I don't know if it's because the press made people sort of paranoid to the point of delusion.
It's a communist plot.
But the delusionality, it's been frankly delusional. And now that delusional kind of thinking has trickled down into these vaccine folks who have been skeptical about the source of the delusion, and now are adopting their own delusional field thinking about stuff. It's like the delusion has trickled down and shifted. The people who are delusional now are the ones who were saying, "Hey, you guys, you're panicking unnecessarily. You're thinking delusionally," and now they're thinking delusionally. It's the most bizarre thing I've ever seen. I hope somebody can analyze it, figure it out, write a book about it one day. All I know is that our thinking has been impaired to the point where, again, I just go back to basic science training. People, if they had a sort of a structure to fall back on, where they could sort of start to use careful, it's all cognitive dissonance, it's all cognitive distortions. And if we could get back to a world where people used, sort of careful, strategic thinking, but very few people are trained to do that. And so a lot of people have fallen victim to the delusional sort of sway of the moment.
Like riding a bike and wearing a mask.
Yeah. Gosh.
I'm not wearing masks outside anymore. I refuse.
Well, there's Murja. That's there's one of the resistant folks right there. Liam, what's going on?
Hey, Dr. Drew. Thank you so much for having me out. This is awesome. How are you?
I'm good. How are you?
I'm good, thank you. I've got a bit of a lighter question, but still very related.
All right.
Sort of a going back to normal question.
Mm.
So just a bit of background. I'm a mid-20s guy. I've got a group of friends that every year I go to we Airbnb a cabin out not far from just a few hours out, and it's a tradition. Now this year, obviously, there's a lot more COVID-related, safety questions of, okay, so some of us have the shot, some of us have decided not to. And I was presented a challenge just shortly before jumping on with you, which was, so I have chosen not to, at this time, receive any of the available shots. And the compromise that was presented to me from the majority that have received the shots who are uncomfortable was, would you get a test within a certain amount of time to show
that's the way to deal with this. That's the way to deal with
it.
Yeah,
for sure. But then the other layer is, now I'm a layman, and I'm also willing to, you're totally right about delusional thinking. And I think it's important for everybody to be self-aware of the possibility of our own delusions. So that's what I'd like to do now.
And by the way, what I am not saying is if you choose not to get the vaccine, you're delusional. I am not saying that. She was saying what's fueling the extreme hesitancy, and I think there is kind of a delusional background. But somebody who gets all the data, looks at it, is young, and chooses not to take it, I'm fine.
Fantastic. Well, and it means a lot to hear you say that, actually. Now, the one other complicated part is, with my limited understanding of testing as it is right now, it's my understanding that perhaps the use of the PCR test with the broad approach, the broad way it's being implemented,
30 cycles.
Perhaps
the 30 cycles, you're at high risk for, not a high risk. You're at some risk for a false positive.
Yeah. So I have a similar hesitancy to specifically that test and the way it's being used in my province here in BC. I just don't agree with the way it's being presented in terms of case numbers and such. That being said, I have nothing against being tested. So what I wanted to ask you was, first of all, your take on the PCR situation, but then also if you can provide some clarity on the antigen tests, the antibody tests, and for my situation, which would be the most appropriate?
You could always do a daily antigen test, and there's some pretty good antigen tests out there. And that should make everybody happy. PCR is the more sensitive test. It will pick up, but the crazy thing about all this testing is even if you develop the disease, you may not turn positive for a few days. So it gets kind of wonky when you start using it as a screening instrument to try to determine infectivity. But I think if they'll let you get by without a PCR, I think some of particularly the Abbott antigen tests are pretty darn good. And just do an antigen test every day. They have cartridges you can get. You're going to spend a little money doing it, but they should be very happy with you doing that for them.
Yeah. Okay. Abbott. You said Abbott.
Abbott. The Abbott antigen test is very good. Okay.
That's great. I will look into that. Thank you so much, Dr.
You bet. Oh my goodness. Well, I'm running out of steam, guys. Susan,
everybody wants to know why we didn't have curtains for 6 months.
In our bedroom?
I was telling Anthony Brown that I used to wake up at 6:30 every day because we didn't have curtains.
Yes.
Now we have curtains.
Yes.
So I'm trying to push it towards 8 a.m. so that I don't fall asleep at 8 p.m.
Right. So explain to people why we didn't have curtains.
I remodeled my bedroom windows. We put in higher windows,
bigger
windows, door to a porch, and it took a while to build the porch. But immediately I ran out to this place called Calico Corners, and I met this designer there, and she came over to look at shades because I was thinking electronic shades or just shades. She says, "No, you need to put these drapes in." I said, "Great." You design them. I know nothing about drapes. I am not a drape person. I don't know how. I don't know. This is not my forte. I can do electronic shades. I can build a porch. I can remodel a kitchen. I can put in carpet.
And what happened?
Drapes are not my thing. So anyway, she ordered the fabric, and a month later, she calls up and goes, "Oh, your fabric's not in stock." And I was like, "We don't have any drapes." Okay, well, we'll order some other stuff, and it'll come right away. Another month goes by. We order the stuff, doesn't come. I go on vacation. She goes, "It's going to be here in the end of May."
End of May.
End of May,
mind
right?
you,
Beginning
it just
of
came
June.
last week. So
yeah, and I said, "Great, I'm going to be out of town, but you can come over and put the drapes in." So she shows up, and and I'm just like, "This is ridiculous." I mean, Drew's like, "I really want to have some drapes in here," and so this was like the first thing I planned.
It was
in
affecting
March.
my sleep like crazy.
Yeah, and so Drew got so pissed.
I lost it.
She said
so
she was
you're worried
come.
about the psychiatric stuff from the vaccine? I think that's where it was most manifest.
Well, she called and said, "Oh, the guy came to hang the drapes when we got back from our trip. Couldn't do it while we were gone. No, he was here for a month, and he couldn't figure out how to make it work. And then I was like, I don't know what to do. I'm giving up. I said, why is this my problem? And she, why am I trying to fix something that she made or designed? Drew got on the phone and just ripped her a new a-hole.
I started very nice.
But she's very defensive all the time.
Oh my goodness.
And
so anyway, we were not happy.
Yeah.
Super unhappy. Some of the worst customer service of all time.
So Drew called the CEO.
I tried to reach the CEO. I tweeted. They didn't care.
No,
they don't seem to care about their customers. So.
Well, here's their defense. The defense is, and I hate working with designers. This is why I don't hire designers. I do everything myself because if I don't like it, it's my own damn
You know what?
fault.
I'm gonna.
But wait. Here's the thing. They were short staffed because of COVID. So the
Susan,
fabrics
no.
weren't being
Listen to me.
made in time.
I'm going to leave the clubhouse room right now because I don't want everyone there to have to sit through all this. I apologize for our tale of woe. You guys have been great today. We're going to finish the story on the stream.
First world problems.
The first world problems here. But hang on.
I have drapes
Thank
now.
you
Just
guys.
Hang
on. Thank you in Clubhouse. I'm going to leave quietly. You guys have been great. Kirsten, thank you for bringing up the issues. Bree, very interesting. Keep fighting the good fight. Great questions today. Mirja, thank you so much. And I will be back again probably next Wednesday. Is that accurate on Clubhouse? Maybe something.
Yeah, we'll do this again next week.
Yeah, probably next
Wednesday,
week.
Same time.
Same time, 3:00 Pacific time.
So come back, and we might do a Clubhouse in between here and there. We might have to do one tomorrow. I don't have a guest.
Yes,
yet.
we might actually do one
My
tomorrow.
guest that you set up canceled.
I know.
So
I understand.
But I'm working on it.
Okay. See you later, Clubhouse.
Thank you. And also check us out at drdrew.tv.
Okay, now you finish the story. Go ahead. You had all these curtains.
So anyways, finally, I got a hold of the guy that hangs the drapes, and we were playing good cop, bad cop, and he got them installed. And Drew is very happy now. So they need tie backs, though, because she made them so full. When you open the curtains, you can't see outside the windows, and it's $1 million view. It's like, oh, great. So now we're waiting for tie backs, which will probably cost me another $2,000 and take another 6 weeks. But
oh my God.
I don't know. She sent me this really fancy ribbon stuff. And I was like, the other guy said, you just have fabric left over. You can make some little tie backs with. And I don't know why she didn't make tie backs. It's so weird, but.
All right, so you've had a chance to vent now.
But anyways.
You feel better?
Anthony, I love you.
Anthony Brown?
Yeah.
Okay.
Just don't call me until after 8:00.
Oh, he called you in the morning.
Well, he gives me he wakes me up and says hello to me every day, and I love him. But I'm not waking up at 6:30 anymore. So I'm gonna try to wake up or at least just be comfortable in my bed, just kind of with my eyes half open until 8.
Understood.
And that's Pacific time. So if anybody's calling from the East Coast, wait until 11.
All right. Guys, it has been great. Thank you all for showing up today. We appreciate it. Caleb, thank you for producing this from a distance there. Hope things are well in Alabama and you're avoiding some of the tropical storms. Kristen, Chris is willing to make your tiebacks for you, Susan. So
I know. No, they're working on it. She said by Thursday. She said Tuesday. She goes, oh, I mean Thursday. I was like, whatever. I'm not even going to go down that road. I'm so happy they're just up and they work, and you're happy with that. I can't see out the window anymore, but
Anthony feels now ashamed by your
I'm
public admonition.
No, I just want to let him know that if I get a text, I have to change my notifications on my phone because I'm on a different time zone now.
I see. Okay.
I love Anthony.
Yes, we all love Anthony. And Anthony, we need to have a phone conversation. I keep trying to find time for that. I trust me, I have not forgotten you. All right, everybody. We will be in here tomorrow around the same time. Whether or not we'll use a little Clubhouse or not, or come up with a good guest, we'll hopefully think about that. Naomi Wolf is back in my life, Susan. Why don't we get her back
I
up
can
here, see
call
how
her.
she's doing?
Let's call her. Yeah.
I've been communicating with her a little
I
bit.
texted Alex Berenson. I texted Eliza Blue, and I'm gonna text. But I texted Tyrus. Nobody loves me anymore because we went away and had too much fun, I think.
Well,
or they're listening to my bullshit stories about drapes.
Euro Pop Mart from Sweden. Hi there. We're interesting. What I love about the internet, the international sort of input here.
I do need Chris to live near me and make me drapes.
Chris, there's the call to action, my dear.
Damn it.
Okay. All right, everybody. Thank you so much for joining us, and I will see you tomorrow.